Okay, we're live again. This is the second of our Q&A sessions, our question and answer sessions with Public Health. So today we have our Director for Public Health and Deputy Director for Public Health, and I'll just ask them to introduce themselves. So we'll start with you, Steve.
Hi, Steve Pintus, Director of Public Health for North East Lincolnshire.
Okay, and Geoff?
I'm Geoff Barnes, Deputy Director of Public Health in North East Lincolnshire.
Okay, thank you both. So last week's session was really well received. We had a lot of questions on social media, so what we thought is we'd put some of those to you and see what your responses were and then share them with people. So the first one is from a lady called Val, and Val asks, our elderly are locked up like prisoners. Can you inform when care homes in the area will accept in-room visits from one nominated visitor using PPE? Come on IPC, get it sorted please. We've had the lowest numbers for months and still nothing changes. I think Val makes a good point. Care homes have been closed for a long time, and this was mentioned on the Prime Minister's briefing, so wasn't it? So Steve, did you want to talk a bit about the care home stuff?
Yeah, sure, Royce. Absolute sympathy, I think, with that view, and it's an area of great concern, I think, to myself and colleagues working in the care home sector. There's a couple of things really to say. One is that obviously that the care homes have to take precautions, that we are still open to visitors, and clearly that in the summer months and when the weather was more clement, then we were able to organise things out in gardens and car parks and stuff. So we are aware that as the weather changes, that we have to look at alternative arrangements. We are working closely with one or two care homes to try and come up with a model where we can accommodate visiting from loved ones and relatives. It is difficult though, and will vary from care home to care home because of their capacity in their buildings to do that. But we are on the case. I think the idea that I think Val's put forward is a very interesting one, and it is one that has been raised nationally about whether there's potential for a pilot to incorporate, if you like, one relative into a sort of a form of bubble for care home residents. And so we're exploring that with a local care home to see if we can work that one through as well. I have to say though that Val's observation around the numbers is probably accurate for quite a few weeks ago. It isn't the case now. We are seeing rapid rise in community transmission, and that makes us more concerned, but it equally makes the care home managers more alert to potential transmission into the care homes. So it's not a no. We're still keen for the reasons that Val cites, really, that we try and maintain visitor rights, if you like, and keep the contact with the outside world as best we can. But it is hard. The other thing to mention is if we go up a tier to the high tier, which is not unthinkable given the numbers that we're seeing now, that restricts care home visiting further. It says only essential visiting, and we will have to work very hard to determine what essential visiting means. We certainly don't want it to be no visiting at all, because I think that's actually against the overall health of those residents, particularly going through the winter. So it's a live issue for us, Royce, and we are looking at it very, very carefully.
Okay, thank you. I know there's a lot of people that want to be reunited with their older relatives, and obviously we have to take into account safety from both sides. So this next question I'll put to Geoff then. This is from Denise. Denise asks, if you've been in contact with someone who tested positive for COVID, do you have to isolate even if you're wearing PPE?
Okay, it depends on a number of factors there. So if you've been a close contact and well, by close contact, I mean within say a meter for a minute or more, then most forms of PPE, most sorts of PPE that people wear in their daily activities, the face masks, etc., won't protect you from being a contact. The sort of PPE that's used in healthcare settings does protect you, but very few people are using that in their day-to-day business. The key to not being a contact is to maintain social distance. Anybody who can maintain 2-meter social distance throughout will not be a contact. And that's why we're really putting a great deal of emphasis that as we go through these next few months, when it's going to be quite challenging, please try and maintain that 2-meter social distance as much as possible.
Okay, that's very useful. Thank you. That makes it much clearer. And I suppose the other thing to remember is download the app, because with the app on your phone, you get early notification of if you are a contact as well, and then you know that you need to isolate quite quickly. The other thing that we're seeing quite a lot on social media is more and more comments from people about why we're not looking at things like herd immunity and why we're taking so many precautions. I think there's a perception that we're kind of putting the economy of the country at risk when to quote somebody on social media, when the recovery rate for under 70-year-olds is 97%. I think there is this kind of strong perception now that this virus is no more dangerous than things like the flu that we're used to. What would you say to that about these kind of ideas about herd immunity and why it's important to keep putting these precautions in place?
Yeah, so it's a misconception, the whole issue of herd immunity. Herd immunity is a sort of a term that's applied to other infectious diseases where you're actually talking about sort of 85% plus of the population has been exposed, and therefore that you get that overall protection. That's not even anywhere near those sorts of numbers. I think the Office for National Statistics did the most accurate numbers in terms of exposure. London, because of the first wave, I think is something up at 17% of the population may have been exposed. In our area, it's a fraction of that. And part of the problem for us in our area is that in the first wave, we were largely protected for various reasons. We benefited from the national lockdown before the spread took grip, and therefore we have very low exposure rates in our population. And one could argue that we're say paying the price, but what we're seeing, the rapid growth, is partially to do with that, is that we didn't have that exposure. I think the notion of it sort of being less harmful and therefore what's all the fuss, there's emerging evidence of what's now being called long COVID that is affecting relatively healthy younger people and causing long-term problems, and that's an emerging picture that we know very little about. And that's the thing about COVID. It's all well and good trying to compare it to other diseases, but it's new and we really are learning all the time about its impact. I think the worry is that the transmission amongst younger people, if it stayed amongst the younger people, you're quite right, they recover quickly, the symptoms are mild, and you could say, well, that's fine, well and good, but it's transferring through into the older population and into the more vulnerable population, and that's when we start to see more hospital admissions. And when the hospital admissions go up, you will start to impact on the NHS's capacity, not for COVID so much as their capacity to deal with all the other issues that they should be dealing with, and therefore it will impact on the health of the population more generally. So it's really in all our interests. You know, it might feel a real pain for an individual or for a family, but it's in all our interests and for the whole population in North East Lincolnshire that we do all that we can to keep those numbers as low as possible so it doesn't impact on the wider system. And that's our plea, and it's always been our plea. And I would say, Royce, you know, and we were saying before the call, I think that the problem was over the summer, it really wasn't touching many people's lives, and it sort of led to that conclusion amongst some people that it's not really here, and you've got a lot of people denying that it was even an issue in North East Lincolnshire. I have to say, with the numbers, that the rate that we're seeing now, it must be touching nearly everybody's lives, either directly or that they know somebody that's got COVID. That's the extent to which it has spread, and we really do need people to become more vigilant. They may have forgotten all the guidance, but we really do need them to return to the guidance, follow it closely, and that way we can keep the numbers down.
Okay, I think that's pretty clear, isn't it? I think it ties in as well with our next question about the self-isolation guidelines. So how clear are the self-isolation guidelines, and do you think people are becoming a bit COVID wary of all the rules and regulations being introduced?
I think I fully sympathise and understand completely. I mean, just building on the point I was making, really, I think people have fallen into a period of time when, we're not seeing it, so we can relax. That's unfortunately, I think, carrying forward into this period of rapid growth in numbers, and that's what's probably leading to the spread. I think the very clear message: if you have any of the symptoms, however mild, that you must isolate first. It's not about, I'll get a test to confirm that I've got COVID and then isolate. It's really, really important to break transmission, that people isolate on the at first signs of any of those symptoms, that they put themselves away from people and then seek a test and get it in that order. And I think that's the only way that we're going to try and re-establish control over the current spread of this COVID outbreak.
Okay, and I think one final question I'll put to Geoff. We had a bit of a discussion about this at the start, and you've touched on it as well, Steve, in response to Val's question about care homes. So, Geoff, summing up, this is a question from Lara in Grimsby. Why have we had such a rise in cases recently?
A range of reasons, really. I mean, partly the fact that we hadn't been substantially impacted before meant a lot of the population were going to be susceptible to COVID. We've also always knew that we had a lot of sort of workplaces that were likely to be vulnerable to COVID outbreaks, such as food processing factories where there's low temperatures. So I think we've been expecting outbreaks in those kind of settings for a long time, and so the fact that they're happening now is not an enormous surprise. We also knew that as we moved into the sort of winter time, as the weather deteriorated, we were going to see more cases, and that is therefore as expected. And I think, as was touched upon earlier, that the fact that we hadn't impacted to a great degree has caused some degree of complacency in some people, and a feeling, we got away with it, it's not going to happen, we can go back to normal, etc. And I think it's our responsibility now to really convince people that we haven't got away with it, and we are in for a very challenging few months ahead of us, and people really do need to follow the guidelines, and particularly the isolation guidelines that were just being talked about, whether they're a case or potential contact.
That's all the questions that we've got for this week. I think this is also probably a perfect opportunity to say school half term is coming up. We've got parents, families going away potentially to other parts of the country. We've got students coming home from university who could potentially be coming from high risk areas coming here. So have we got a message for those people? Steve, I'm looking at you in particular.
Yeah, of course, Royce, and I think just to introduce that overall comment and build on what Geoff was saying, really, a huge thank you, really, because I think we wouldn't want to give the impression, to the people of North East Lincolnshire that we don't think people are following the guidance. The vast majority of people are doing the best they can. I think it's just that sometimes we let things relax, and what we certainly picked up on particularly in relation to outbreaks in various settings, be that schools, hospitals, workplaces, care homes. It is about when people's guard is down. So they're doing a great job protecting clients in their work, but it's actually when they're having downtime, when they're socialising, when they're travelling to and from work, coffee breaks, lunch breaks. That's when people are letting slip, really, and they're relaxing. And what we'd ask, really, and the same applies when all the children are off, the university students come back. It's all about vigilance. It's all about remembering the basic rules, and the basic rules is keep your distance, wash your hands regularly, and obviously, you know, wear a face mask when it's mandated to wear a face mask. But the big one really is keep your distance, and that way we stand a chance of actually avoiding further restrictions, which would be incredibly damaging to our economy and to local jobs, and we really want to avoid that. And also, it keeps the COVID virus out of our care homes. So you may not have a direct relationship with anyone, but actually what we've demonstrated, I think, is that it's touching everyone's lives, and it's through indirect means that we can end up in having outbreaks in care homes and a huge increase in numbers in hospitals. So everybody can do their bit. We're really grateful to all the efforts to date, but we really do ask that do not let your guard down and keep vigilant.
Okay, I think there's a very clear message throughout that, isn't there? So I think I'll just end that by saying thank you, Steve Pintus, Geoff Barnes, for your time. Thank you.
Thanks, Royce.